Good morning and welcome to Health Talk here on AM 1270 and 96.5 FM KXBX. This is Paul Thomas here today with Bill Kearney of Northlake Medical Pharmacies. And Bill, well, there's no going back now. It's official. The inauguration happened.
Yes, it did.
The march and all kinds of executive orders. I read that the wall's going up and boy, I tell you what a change. Huh?
Yeah, and we don't know about healthcare. Everything's, it seems like he's tackling everything all at one time.
Yeah.
And we're just going to have to see. I get so tired of the negative things. It's hard. If I was in that office, it would be hard to be carrying on a positive thing. I think we ought to let the numbers go. The man's president of the United States. If they want to say there weren't any people there, let them say there weren't any people there. Just get on with what we hope is a change in a lot of things. And the big thing, of course, for us is healthcare. We have no idea where that's going. A lot of what we're going to be talking about today is the price of drugs and whether or not there's any way to stop that huge increase we have, and the fight that the president faces over drug prices. He made it clear that he thinks drug prices are too high and that the pharmaceutical industry, as he put it at the news conference this month, is getting away with murder. And there's a lot of lawmakers that agree with him who have looked at drug makers in recent years for high-priced medications that are out of the reach for many of us, especially if you're really ill. So on Monday, Sean Spicer, his press secretary, reaffirmed the issue would be a top priority. One of the proposals that the president made was to force drug makers to bid for the right to sell their products to Medicare beneficiaries. There's a law on the books right now that says drug manufacturers have not had to bid to the country on whether or not it was a price approved by them. So the drug makers have repeatedly failed to attract enough support in Congress, especially among the Republicans who are in charge of that division right now. So, Big Pharma, who are the drug manufacturers, have a lot of lobbyists and they have a lot of power, and there's very little bidding. And we're the largest buyer of drugs in the world, and yet we don't bid properly. We could save billions of dollars. And the polls show that the public really wants that. They want us to have a better way of doing that. But there's a legislative provision that prohibits the federal government from negotiating directly with the pharmaceutical companies for drugs that are paid for by Medicare. And you've heard me talk about PBMs, which are pharmacy benefit managers, and those are Caremark, United Healthcare, Express Scripts. They are the ones that are governing the price of these. No matter what the manufacturer of the drugs do, they're the ones that manage how this transfers over to the patient and to the pharmacy. So removing the prohibition that is the favorite cause of the liberal politicians. Bernie Sanders was one of the ones that was leading that charge, but it's been opposed by the pharmaceutical industry, and we don't know where that really is going. They declined to say at the confirmation hearing last Wednesday when Tom Price was nominated for the Health and Human Services if they're likely to question him on this issue or not. So the reason the government can't haggle with with drug companies is because of the PBMs. And Medicare did not cover prescription drugs until 2006. And I know that's hard to believe for us now that it's 2017. It seems like it's been going on forever. But for those of us in the pharmaceutical industry, we know because we've had to retain those prescriptions instead of for 3 years, for 10 years. But the measure included something called the non-interference clause, which was backed by the pharmacy industry, meaning the manufacturers, and prevented the federal government from negotiating directly with drug makers. So the PBMs are the ones, Express Scripts, CVS, and United Healthcare are the three ones that argue the pricing, and they make it so it's good for them but poor for the patient. Would it actually lower drug costs if they did this? Many health experts are skeptical that a repeal of the non-negotiating ban would have much impact, and certainly not the billions of dollars in the reductions because of those three groups, which is CVS, United Healthcare, and Express Scripts. Even if it was repealed, another provision would stand in the way. The government must cover all drugs in 6 protected classes. Broad and often expensive treatments for patients with conditions such as cancer, depression, epilepsy, and HIV. Now, the interesting thing about some of these diseases like hepatitis that they're treating for $1,000 a pill, 70 or 80% of it, even more in hepatitis C, is actually transferred to a patient to give them through bad needles. 90% probably of all the hepatitis C is because of drug injections with dirty needles. So here is a disease that we're paying hundreds of thousands of dollars for, millions of dollars for people that were careless in taking drugs. Now, that doesn't mean everybody that has hepatitis C. Some of them got it from transfusion, some from other countries who don't scan their blood before they give it and don't look for those antibodies or those traces of hep C that could be in the blood that they're actually transfusing. So the Veterans Health Administration and the Defense Department, that was a big issue in the election this time, are able to negotiate lower prices in part by covering fewer drugs. Now, there's a price for everything. So if you're in the VA, there are drugs that you can't get, but the maintenance drugs you get are very inexpensive because they can negotiate prices. You'll get your largest negotiating power from your ability to walk away, as our president does in many cases. You're fired if you don't do this. If you don't negotiate drug prices, then you walk away. Well, when it comes to this part, the government cannot walk away. Even if Medicare were to remove those protections and agree to cover fewer drugs, a politically unpopular move that failed in the past, drug companies will find a way to make up financial losses. And a consulting firm that works for drug companies, hospitals, insurers, so there's many ways they can do that. The most expensive drugs typically treat rare conditions like cystic fibrosis, certain types of cancer, for which there are few options. In those cases, drug companies hold the bargaining power no matter who's on the other side of the table. So if you force one price across the market, you may as well end up with a higher price in not competitive categories that you would otherwise find relatively inexpensive. A good example of that is generic drugs. Look at the price of some of the generics that are on the market now and what they were 3 years ago or 4 years ago and the price of what they are now. And a good example is what we were talking about last week on the end of life. Seconal and pentobarbital used to be 99 cents a hundred. That was when it was brand name. It's now generic, and it's $3,000 to $4,000 for 100 of them because it can be used at end of life. Eye drops. A person came in the other day, brimonidine tartrate and brimonidine plain. They're to lower the ocular pressure in the eye. The tartrate is $180. The other one, it came out as Alphagan and Alphagan P. One is a 0.15 and one is an 0.2 or 0.02 percentage, and the other one is less than $25. Same drug, different base. Now they no longer make the plain one anymore, so you have to buy the $180 one. So that's what happens when you start regulating the price of these real expensive drugs that you're treating somebody that's terminal or almost terminal. Some people worry that if the United States government were to significantly lower drug prices for Medicare beneficiaries, the pharmaceutical companies would raise the price on millions of people insured through large employers or private insurers. Others contend that if the prices negotiated were public, the transparency could level the playing field and lower prices across the board. During the campaign, Mr. Trump joined his Democratic opponents in calling for the federal government to be allowed to negotiate the price of drugs. After his election, the drug industry exhaled when the healthcare section of the transition website included more traditional Republicans and did not mention the negotiation. So something has to change. And if you have ideas on changing the drug prices, certainly get them to your congressman or senator. I don't know how much they will listen, but something needs to be done in order to enhance these prices so they are affordable. We're hoping that they will demonstrate, but support anyway, a measure that would allow Medicare to stop covering drugs that are so expensive that they can't afford it, or a limited effort to do that, in a sense that if doing it on one side is going to increase the price and only Medicare D recipients can get the drug and the other recipients can't, then they're making it up on one side and hitting it on the other side. So the people that aren't on Medicare D, the people under 65 that happen to have cystic fibrosis or muscular dystrophy or one of those drugs, will not be able to afford the medication. So the real reason that Medicare is a lousy drug negotiator is it can't say no. You've heard me talk about drugs that we get at the end of the month. We get something called a DIR fee. That's direct enumeration price adjustment that it's called a return. The return is supposed to go to the patient and is supposed to go to the pharmacy. Instead, it goes to the pharmacy benefit managers. And I was just looking at one of our stores yesterday. In the month of December, it was over $3,000 that we got after we filled the prescription. Excuse me. After it was reconciled, after we found out we made $1.85 on that prescription, we lost $1,500. What we're trying to do is get a transparency so we see when we fill that prescription that we're going to lose the money. And if we fill it one time and tell the patient we won't fill it again because we can't afford to take that kind of a loss. We don't do it now. We let it go, and then this has become a phenomenal way. In the last year, between the two stores, it's over $100,000 that we have lost by filling prescriptions that they took the money back on the rear end. Now, that would be like you buying a pair of shoes and them telling you it was $100, and you paid the $100, and then they would come back in 3 months and said, these cost more than we thought they did. You owe us another $100, or you either give us the other $100 or we take the shoes back. So if you talk to experts in the pharmaceutical market in the United States, they aren't very optimistic that by itself letting the government play drug negotiator would take a big bite out of prescription drug spending. The new drugs that are coming out are horrendously expensive. We talked many times on this show that it's related to effectiveness. So if you've got hepatitis C and you take Harvoni, which is $84,000 a month, and the person that dispenses it gets $800 for dispensing it and waits 90 days for their money, that 70% are cured. So they're cured and they're not going to die now of hepatitis C. So how much is that worth to an individual? How much is that worth to the drug company? How much is that worth to the pharmacy provider? And that's how they're judging the price of medications. And if you don't like it, they will raise it again. We were told last year that in 2016 that all the brand name manufacturers would keep their increases to single-digit increases. And normally they increase the price of their drugs once a year. What did they do this time? 7.9% and 9.9%, one in March and one in December. So you have a double-digit increase just at one time. It's a single-digit. And they keep doing it. If you don't like it, then try to negotiate a different price someplace else. We were on the phone yesterday with a drug pharmacy benefit manager. This drug that we were dispensing, several prescriptions, we had lost a good amount of money on workman's comp through a large retail company that had insurance. We were being paid 6 cents a pill, and the most dead net price that we can get on this medication is 16 cents a pill. And we have tried every place. And with workman's comp, you either fill it or you don't fill any workman's comp. So we've been filling it, so we called the pharmacy benefit manager and said, look, we have 17 prescriptions here that we have lost at least 10 cents a pill on dispensing these. And these quantities are not small quantities. They're 100, 120, 240. And in negotiating or talking to the customer service representative, their answer to us was, well, are you saying you want to send them someplace else? And my bookkeeper said, I didn't say that. I know this is being recorded. I didn't say that I want to send them someplace else. I want to get paid for what I'm dispensing. And I want to know when I'm dispensing the medication how much I'm losing. And we've gotten all of these together, and this is how much we're losing. This is how much we pay for the drug. This is how much you're paying us back for the drug, and we're losing 10 cents on every pill that we dispense. Now, that may not seem very much, but just to lose money on prescriptions is an everyday thing today with third parties. But to lose that much on a pill that you're dispensing 120 of or 240 of is not acceptable and is something that's filled all the time. So we know that that this has to change, whether or not the new president. I'm on a national committee, a national board of directors, and a national committee that deals with the government in Washington, D.C. about these issues. They are listening to us, but whether or not you can get the rest of the country to realize that there's definitely a negative downturn in drug pricing and the cost of drugs that are going up. The growth rate for the United States spending on medicines will decline by 12% in 2015 and between 6 and 7% in 2017, but prescription drug spending is forecast to grow between 6 and 9% through 2021. So the decline reflects the end of hepatitis C drugs, where when they first came on the market, we were dispensing tons of it, and now that impact is kind of slowed down, including the introduction of biosimilars, which are drugs that are like a generic version of the drug, but not paid for by the same way. So U.S. brand drug prices will increase at a slower rate due to the competition from the generics and the congressional backlash over these high prices. Brand prices will increase at 8 to 11% more slowly than the 12 to 15%, with fewer major price increases as they've become unsustainable in the light of the media attention. So out-of-pocket costs, which to me, my insurance last year, I paid $700. The cost of my medication was $712. My out-of-pocket was $657. So that's how much my insurance paid for Medicare D. And that's going to get worse. That's why we encourage you on Medicare D to look at every venue from October 15th until December 7th. Even if you feel like you are comfortable, I changed insurance plans because of that. One of the insurance plans is Humana. That was the one I was in. Yes, it was less cost for me for premiums and copays. Premiums, not copays. But I ended up paying 99% of the cost of those prescriptions. Not a good program. So I changed to a different program this year, and we will see. There's out-of-costs. Prescription prices are being focused on right now. A lot of these companies with the expensive medications, and many of you are recipients of copay assistance for the brands. Notably, more than a third of the prescriptions will have no out-of-pocket costs. They will give you a coupon. We will make a minimal amount on that exchange. You will not pay anything. They're a growing trend as some patients receive preventative services under the Affordable Care Act, under expanded eligibility, and through some insurance plans. How much or how long that will last, we don't know. And there are several new therapies that are moving through the registration process around the world and are expected to come to the market soon. So HIV, bacterial diseases, hepatitis C, malaria, arthritis, all those things are going to be new, and they're in the hopper right now. And everything that's coming out is expensive. There isn't any drugs coming out that are going to be like in the old days. This is what the research and development costs us to put the drug out until we get our money back and it gets off patent. That's what it's going to be. Now they're going by what is it, how cost effective is this drug in treating this disease. If it's important that this drug get on the market and they know it's important, they will escalate the price up to $100,000 or more if they have to. And before we take a break, some of these new drugs for hepatitis C, are they safe? And I just saw a report in the New York Times yesterday that drugs approved in recent years that can cure hepatitis C have severe side effects. And we know that, and we know it when we dispense it, but how prevalent is that, including liver failure? The number of adverse effects appears relatively small, and small studies, so these aren't conclusive, but experts said the report was a warning that should not be ignored, and it involves 9 widely used antiviral drugs that were heralded as a huge advance because they greatly increased cure rates with few side effects. But there was a study by Dr. Brown, the director of Center for Liver Disease and Transplants in New York, who was not involved in the study, but there had been other scattered accounts of problems. Dr. Brown added that the problems might arise from doctors prescribing incorrectly, giving the drugs to patients with liver function too poor to tolerate them or benefit from. In the United States, an estimated 2.7 million to 3.9 million people have chronic hepatitis C. That means it's ongoing all the time. At least 20,000 a year die from it. The most common source of infection is the needle sharing among people who use illicit drugs. So there's no vaccine to prevent the infection, so treatments have long been sought. The drugs covered in the new report, Sovaldi and Harvoni, both made by Gilead, are priced at $1,000 a pill, and with billions of dollars in sales. And some of the drugs were causing a problem in those treated with 250,000 people took the new drug in 2015 at the expense of up to $125,000 a patient. And those treated during the year ending June 30th last year, they identified 524 with liver failure, 165 of those who died. Of those with liver failure, 386 were from outside the United States, and an additional 1,058 had severe liver injury. And in 761 of these people, it didn't work. But all types of drugs, they received nearly 300,000 new reports of adverse events during the second quarter of last year, and most of the events were described by doctors and health care professionals because it's imperative that they follow that reporting procedure. So right now we're checking other cases of liver failure. It's important that doctors prescribing the new drugs needs to have an LFT test, which is a liver function test, and determine how beneficial and how the new drug will be received by that individual if they have a huge amount of liver failure. So we're going to take a break, and we're going to change here for a little bit and talk about National Baking Day, what we should eat or if we should eat anything. I don't even know when National Baking Day was. Do you, or bacon?
I have no idea, but I'm
bacon.
happy to find out.
Okay, all right. Hi, I'm Bill Kearney from Northlake Medical Pharmacy. Recently, I visited Mrs. Goodwin's third grade class at Lakeport Elementary School to answer some of the students' questions about their health. Here's what they had to ask.
My parents say I have to take vitamins. Why?
Usually because so many kids eat a lot of fast and processed foods, we don't eat enough fruits and vegetables. We always try to teach kids to eat healthier, but we aren't very successful at that. Northlake Medical Pharmacy, a good neighbor pharmacy, is offering a Healthy Kids Free Vitamin program to the kids of Lake County. Any child aged 2 to 12 can receive a free 30-day supply of children's chewable multivitamins every month for a year. Simply sign up your children at either of our 2 locations at 347 Lakeport Boulevard in front of the Bruno's Shop Smart. Call 263-1328 or at 5136 Hill Road East across from Sutter Lakeside Hospital. Call 263-6192. The Healthy Kids Free Vitamin program at Northlake Medical Pharmacies.
They're good for us.
I loved playing high school sports. I loved the competition, the camaraderie, the bands, the crowds, all the pageantry, and I wanted to keep playing. But I graduated. No colleges called, and neither did the pros. So, to stay close to the game I loved, I decided to become a high school official. You know, a referee. When I played high school sports, I learned the importance of integrity, good sportsmanship, and respect for the rules. Now as a high school official, I get to help model these same values to others. Maybe the colleges and the pros didn't call, but the kids in California did. And now, I'm enjoying the competition, the camaraderie, the bands, the crowds, and all the pageantry of high school sports all over again.
This message presented by the California Interscholastic Federation and the California State Athletic Directors Association.
Grandpa, look what I got.
Wait till you see the bike we got for Jake. It is the coolest thing.
Hearing loss happens gradually with age, making it easy to ignore. Yet most older Americans aren't getting their hearing tested.
Dad, can you hear me?
Untreated hearing loss can keep your loved ones from enjoying what they cherish most. Don't let that happen. Speak up about hearing loss. You'll be glad you did. Brought to you by the American Speech Language Hearing Association.
Tooth decay can happen at any age. The crowns of your teeth are covered with a hard tissue called enamel, which protects your teeth from decay-causing acids produced by bacteria. Beneath the gums, the roots of your teeth are covered with a softer tissue called cementum. If exposed, the cementum is more susceptible to decay and more difficult to treat than decay of the enamel. As you get older, your gums may recede, exposing the cementum. This may be due to periodontal disease, plaque buildup, trauma, or heredity. Also, old dental restorations may begin to weaken and create crevices that allow bacteria to accumulate, leading to decay. Brush twice a day, floss once a day, and schedule regular dental checkups to help keep your teeth healthy for a lifetime. For the ADA Dental Minute, I'm Dr. Maria Lopez Howell. For more information, visit our website at ada.org.
All right, we're back. Bacon Day, huh?
Bacon Day. I don't know when National Bacon Day was.
I can look it up here.
This was on
I'll figure it out.
Consumer Reports. It was on December 30th. It said, if you're looking to celebrate National Bacon Day, which I probably would.
February, let's see here, Sunday, February 26th.
Oh, we've got time to order some bacon.
There you go, yeah.
Well, you might think that turkey baking is the best way to go. But if you look at the nutritional details, you won't really be doing yourself that much favor. So both kinds of bacon are processed meats, and as you know, we don't think processed meats are healthy for you, and nobody likes sausage better than I do and bacon. But a Harvard study linked a daily serving of processed meat equal to 1 hot dog or 2 slices of bacon to an increased risk of early death from heart disease and cancer. So, you know, the regular bacon that we have is made from the fat belly of the pig, while turkey bacon is made from a combination of the dark and light meat from the bird. So turkey is lower in calories and saturated fat, but the differences are pretty small. And it's also lower in protein and higher in sodium, which is a bad thing for you. So of all your choices, Canadian bacon is probably the healthiest. It's made from the loin, which is a lean cut of pork. So it's lower in fat, and because it's cured, not smoked, it's lower in sodium. So though tasty, Canadian bacon may not satisfy a true bacon craving, though for many it tastes more like ham.
I'm looking online here, and I've got like 5 different National Bacon Days. I've got
Oh, really?
December 30th was one, it said here, and then I'm looking at one, it says August 30th. The February 26th day, I said, let's just say every day is National Bacon Day. How about that?
Well, the advice from consumers is it shouldn't be a regular part of your diet, but if you want to indulge in an occasional BLT or an occasional bacon day, have a few strips with your eggs, or National Bacon Day, choose the type that you like the best. Calories in regular bacon are 108. That's 2 slices. Turkey bacon is 89, and Canadian bacon is 40. Fat is 8 grams in 2 slices of bacon, 6 grams in 3 slices of turkey bacon, and 1 in 2 slices of Canadian bacon. So the sodium is the highest in turkey bacon, actually. It's almost 500 milligrams. 387 in regular bacon and 274 in Canadian bacon. So yesterday I probably, a friend of mine goes and cooks for one of our friends that's 99 years old every Tuesday, and we go, about once a month I go with him down with this fellow and have breakfast. So yesterday it was deer sausage.
Ooh.
1 slice of bacon, 1 egg, 3 corn pancakes with butter and syrup, and hash browns.
Sounds good to me.
And I eat every bite of it.
Yeah.
I normally, for breakfast, I either eat a couple of eggs or a bowl of cereal.
You do this at his house? Do you guys go out somewhere?
No, we go and cook at his house.
Okay.
And sit there and shoot the fat. And on April 1st, he'll be 100.
Good for him.
And
wow.
he's this gentleman loves to cook for him, so once a week on Tuesday, he goes down and prepares him breakfast, and we all kind of share some camaraderie. And anyway, people, this is the time of year. Paul, I know you're probably getting ready to lose weight so you can get in your swimsuit.
Oh,
and,
sure, yeah. As cold as it's been, yeah.
Find a way to get your body in shape for the summer, where you can lay out on the beach and get skin cancer. So,
okay.
The green tea is one of the ways that a lot of people, it's been hailed as a fat burner and a cure-all for cancer and heart disease, but and it has a tremendous amount of popularity all around. And whether or not there's a specific substance behind the claims that it's good for your waistline, we aren't sure. It can raise your metabolic rate, which is the same thing that we talked about on hot pepper last week. So you burn more calories. But green tea is probably due to the combination of its caffeine and its antioxidants that are plentiful in green tea and present in smaller amounts in some fruits, dark chocolate, and red wine. So would you rather drink green tea or red wine? But the effect is likely to lead to little, if any, change on the scale. People think if you drink a few cups of green tea, you'll see the fat melt away. That's just not going to happen. Nutrisystems is another way that a lot of people are losing weight right now, or one of those measured foods, and it's the quantity of meals that makes it effective. And you look at these little dishes of Nutrisystems, which are the size of a 3x5 note card, and they have a plan that helps you do it. And as long as you keep doing that, you lose weight. As soon as you stop doing that, it comes back at you. So the green tea, even at large doses, the weight loss is minimal. Once more, experts warn against taking large amounts used in some of the studies because of liver damage. Can it prevent cancer? There's no solid proof that it can. Most all of these things that you hear about, these natural substances, if it was really that effective, you would see a huge amount of it being promoted. Can it protect the heart? Experts say it may reduce high cholesterol levels and high blood pressure, which are important, but it isn't a miracle cure. You know, we talk about these things, Paul, from time to time, and it's diet and exercise, diet and exercise. Yep. Now you're doing, you're teaching basketball now, right? Coaching?
Yep.
And do you get out and run with them when they're out?
Yeah, a little bit. I mean, I'm not running up and down the court, but, you know, I get out there and move around. Yeah. So, you know, I'm not just standing around. That's for sure. But
do you ever make a basket, or?
Oh, sure. They have the nets lowered, you know,
to
8 feet. So yeah, it's not too hard. But no, I'm enjoying it, getting out there, moving around with the kids. So, and I got baseball right around the corner too. So that one, I move, you know, I get out and move around a little bit too. I remember growing up, my dad coached me in baseball, my brothers too, in Little League, and he was he was about 5'8", heavy set guy, and he would run. He'd make the team do a lap, and he'd always run the lap with the team, and he'd say, if anybody loses to me in the lap, or, you know, if I beat anybody back, you got to run again. And, you know, nobody ever lost to him because he wasn't very fast. But, you know, he got out and ran a little bit. So,
well, when I was in the military, when I joined, I weighed 245 pounds, or when I was drafted. When I got out of basic training 8 weeks later, I weighed 165. And I would run until I was already graduated from pharmacy school. I'd been practicing pharmacy for a year. And when I would run, they'd run me until I'd pass out. And then they'd throw water on me and get up, and I'd run again until I'd pass out. But those drill sergeants were in such magnificent shape. And then if you had a weight problem, you were a road guard. So you'd run 7 miles a day with a full pack on and a weapon. And the road guard would be the last guy at the end of the column, and so when they'd yell "road guard," come to the front, they'd say "road guard," and there I'd go, you know, a little fat round ball standing there to stop the traffic as the column went through, and then they'd yell road guard recover, and I'd go clear to the end again. So I'd always have to run the whole gamut.
Oh, wow.
Didn't take long to get in shape, but I was also, these guys this was at Fort Campbell, Kentucky, 101st Airborne. They were all 17, 16 years old. They'd all lied about their age. They were all whiskey runners, and here I am, a fat pharmacist that had been out of college for a year, and so they'd look after me. Come on, Doc, you can do it. You can do it. And I got me and one other person was already a college graduate, and I made the mistake when I got off the airplane of telling the drill instructor, "Look, I'm a registered pharmacist. I'm a college graduate." "Oh, listen to this. I bet he brought his mommy with him too, you know." Drop, fat boy, and do 100 push-ups. And I don't think it's that way anymore. But you know, I was at the stage mentally, because I'd worked my way through college. I thought I was really something.
Yeah.
And I wasn't. I wasn't any better than anybody else. And the military taught me that, and very much humbled me as far as who I was and what I thought I was. I was born and raised poor, and thought now that I'd made it and I was making good money that I was better than other people, and I certainly wasn't. So our number is 263-5252 if you have any questions. We were getting some calls about flu vaccine. We're out. They're already calling it back in again, saying send back what you haven't immunized with. We'll give you credit, and what's your order for next year? So we're still giving pneumonia shots. We're still giving Zostavax shots for shingles. We're still giving tetanus shots. A whole gamut of immunizations that you do not need prescriptions for anymore from a physician. We will send a record of those prescriptions or immunizations to your physician. And what we're finding out right now is many people do not have a physician because there's been a exit of a lot of the physicians out of the area, and there's fewer and fewer that are not that are independent and working for themselves. Most of them are working for clinics now. So I know you will see a lot of information on whether or not you should get vaccines or not, and why not strengthen your immunity naturally instead of getting vaccines. That's a big issue right now. And the other issue is why get vaccines for illnesses that are no longer exist in this country. And we talked about it last week. That's what we thought about polio. That's what we thought about measles. That's what we thought about mumps. They're all coming back because kids aren't getting shots in many cases. And we talked about California being the strongest immunization policy there is. And the link between mercury, thiomersal, and autism and allergic reactions. I have, as you know, an autistic grandson, and they thought when they first became aware of my grandson's autism that he would be that it was going to be caused by the MMR shot, measles, mumps, and rubella. There is no link to that. That was a situation that occurred by some, I hate to use this word, fake news that came out of England, Great Britain, several years ago that was not the truth. So somebody asked me yesterday about hepatitis B, and if you got hepatitis shot when you were young, would you need it again? And you don't. It's a series of shots that you get, and a lot of people that are getting into New jobs right now are required, especially if you're working for the school system or hospitals, to get caught up on your shots. Part of the problem with people not wanting their small children to get shots is they think that they get a barrage of shots at one time, and it's just not healthy. It may be a little bit, traumatic at the time, but as far as causing a problem with their health, there's not a lot of clinical evidence to support that. I had a lady, a patient, the other day that did get a Zostavax shot, and that's for shingles. And we give that shot subcutaneously under the skin. It's a frozen vaccine that we have to activate once we know the patient is here to get the shot. We don't do that until the patient gets in the pharmacy, because it costs us $220, the shot itself. So if all of a sudden the insurance doesn't cover it, or you don't want to pay whatever your copay is, we have to throw it away. We can't use it once it's been activated. But normally there isn't a reaction from it. If it is, it's a very small reaction. We use a very small needle going under the skin in the back of the arm. This patient got that injection on Friday or Saturday, and by Monday, first it was just a little area like the size of a quarter, and then it got bigger and more tender, and the reaction seemed to have spread. I reviewed the lot numbers of what we had given, and that's exactly what we given. The diluent was correct. The reaction was unusual but not unexpected. I've had 3 people in the time that I've given those shots that had a reaction like that, and I've probably given 500 or 600 in the last years that this medication has been out, maybe more than that. And most of the people I know, so I would know if they've had a bad reaction like that. And I did have just a patient 2 or 3 months ago that had a reaction like that. So it's not unusual when you get a reaction that's a little more than normal, but it's always good to call the pharmacy or the physician wherever you get the medication and you get a reaction. If it's causing you to have a problem breathing, call 911 or go to the hospital right away. If it's just a rash that doesn't really go anywhere, it will enlarge that reaction for 3 or 4 days, and then it'll start diminishing. Usually it's just the next day. You might get a hardening of that skin, depending how tight you were when we gave you the injection, because people have a tendency to tense up when we're going to give them a shot. That constricts the nerves and the blood vessels, and so when the injection goes in and your arm isn't relaxed or your shoulder isn't relaxed, it doesn't have any place to go. So it builds up right at the injection site, and that's what you get. You don't see that too often in subcutaneous shots, because remember, everybody that takes insulin takes it sub-Q, and most of them give it in the stomach. We can give a subcutaneous shot any place, but the preferred place for the kinds of immunizations we give are really in the back of the arm. So I just want to make you aware that we're still doing those things, and just because the flu season is over doesn't mean that we aren't still giving immunizations. I want to remind everybody about the End of Life Options Act. That's going to have a workshop by hospice on Saturday, the 28th, from 10 a.m. to 2 p.m. It's on Parallel Drive, the hospice building there. You'll know how the End of Life Option Act is being implemented in religious and ethnic considerations, family dynamics, communication with family members and loved ones. There are some hospitals, because of their ethnicity or their religion, some Catholic hospitals that will not be involved in doing this. There are some physicians that don't want to be involved in doing this. There can be pharmacists that don't want to be involved in doing this. It's quite a lengthy procedure to go through, and it takes a few months. And the more informed you are about how the process takes place and what you have to do in order to get through this process, the easier it is to understand, and the more popular it becomes. The American Medical Association has agreed to study whether it should also move to neutrality on the physician-assisted death. They haven't decided yet, but even as the idea gains acceptance and the bill became passed in California, moreover, California hospitals and hospices can forbid their physicians to write the necessary prescriptions even if they're privately practicing. That's not the case in Lake County. The shortage of participating providers has led to a lot of patient and family frustration. So it isn't seamless. It's a new venue that's been in Oregon and Washington for some time. Medicaid does pay for the cost of the drug. There are new venues now as far as the medication where we can improvise and give a combination of things that aren't quite as easy for the patient, and aren't quite as easy for us. But there are venues that make it affordable if it's not covered by insurance. So just want to remind you that's on this Saturday at the Hospice Services building on Parallel Drive, and it's from 10 a.m. to 2 p.m. It's for Lake County residents that are interested in learning more about the new law and discussing how that takes place. I'd like to remind you we're Northlake Medical Pharmacies with 2 locations for you at 5136 Hill Road East across from Sutter Lakeside Hospital. Call us there at 263-6192. And outside the Bruno Shop Smart at 347 Lakeport Boulevard, call us there at 263-1328. Thank you, Paul.
Thanks, Bill, and we'll welcome everybody back here again next Wednesday at 10 a.m. for Health Talk on AM 1270 and 96.5 FM, KXVX Lakeport.